Hi, my name is Kate. I'm a scientist. I'm originally German, but I've been living in London for many years, 14 years. I've been here just leading my life, having a variety of relationships, different boyfriends, and at the end here now I had a very long relationship, and then I got to the point where I had advanced in age, and I realized at some point that, oh my God, I am 35. And then my boyfriend broke up with me, and it sent me in a little bit of a spiral of realization and kind of recognition of my situation, and really put me in the context for the first time of questioning whether or not I wanted to have children. All of the years in London I spent really honing my craft as a scientist and working first doing my PhD, then going through academia, and now working in biotech. And I've always been really focused on doing a great job at work and getting to the next step and next promotion and the next thing, and always really driven and always had this as part of my own identity as well. And I never really thought about having children necessarily, but not because I didn't want it, but more because I thought there's always still time. It's always like something in the future, and I felt very much like the difference between 25 and 35, that's 10 years that went really suddenly, and it really came very sudden for me. And I thought for a moment, that's just it. I cannot have children now. I am too old. My body is progressing, and as a scientist I also know what that means. So I looked at a lot of scientific literature and just went like, oh my God, your chances to become pregnant and then have a healthy child are just decreasing rapidly, and I am at the absolute stage of where this is like very rapid now, and I need to do something about it. I had a lot of friends around me saying, oh, you can be absolutely happy without a child, and I was asking myself that as well. Maybe I don't actually need to have a child, and I'm still, right now, even after the procedure, still not sure if I will have a child or no. And it's just kind of put me for the first time into that mindset of thinking about this, and realizing that if I don't do anything, the chance and the choice gets taken away from me just by time and biology. And I really felt very pressured by this feeling of loss of control, and I'm an independent woman. I've really throughout my time in my life, not just in London but throughout, I've really always valued my own control over my life a lot, and this loss of control or perceived loss of control of my future really then was something that I needed to do something about. So then I went on the internet and I did a lot of Googling, but because I'm a scientist, I love myself an Excel sheet. So I did a big Excel sheet doing all sorts of analyses about the different parameters that I could come up with for all of the different clinics for egg freezing that are in London. Egg freezing really was something that came up very, very by chance, because I hadn't even considered it. It wasn't something that I had ever really heard about before. So that year when I was 35 and the breakup happened, that was the first year I also heard about this. I always just thought it was freezing embryos, or really just for making it possible for couples that cannot have children to have children. But it was never in my mind at that time about preservation of my own fertility, preservation of my choice effectively for the future. And so who actually told me about this was a much younger friend. She was 27, and she said, oh my God, I'm thinking about egg freezing. And I just was like, oh my God, freezing eggs, is that possible? Wow, that's really cool. And so I looked into that, and then all of these different clinics in London, I can tell you that there are many, and they have a lot of information on their websites. I found it very difficult to navigate this. There are information, of course, again, just trying to find the best place to do this, not really knowing what best means at this point. Does it mean the clinic needs to have had so many eggs frozen? But when you just freeze the eggs, then you're not really just looking at the quality, like quantity and quality. We need to take both into account. And I tried to find information about how many women then actually had successfully children from the eggs that they had frozen down, and that information was extremely difficult to find. And I realized all of the different companies and clinics just also present this information so differently, so you can't even properly compare it, and I was getting more and more frustrated with the situation that I couldn't quite make the decision of which clinic I should go for. And then one particular day, I was just thinking maybe I just need to talk to somebody who is a professional. And I had, again, Googled many times around egg freezing and fertility preservation. And one of the top results on Google was this small clinic called Ovom. And I just clicked on it, and I just made a little appointment with, at that time, Lene, one of the co-founders, and it really was kind of for me the start of understanding more and finding more my feet there, rather than, and also emotionally, rather than just all of the science and all of the rational side. But what I realized as well, that I did need to have some sort of comparison, so I did the same thing with other clinics. Several clinics that were much more established, they say things like, oh my God, we're in London for the last 20 years, birthing children, making dreams come true, amazing. So I made appointments with these clinics as well. And then when I talked to these clinics, what actually happened is that the people that I talked to were receptionists, and they just read to me whatever was written on the website. And I was very disappointed because I was like, okay, I read your website. I do not need you to read this to me. I have questions. I need answers, and you're not giving them to me because you're not the professional person actually to ask this. And then I had the call with Lene, and it really, really opened my mind in such a way that I was like, oh my God, I'm getting it now. I get what the process is. I get what it not just involves scientifically, because that I had understood, but really what it means for the patients and how this would actually practically happen in the clinic, and for me if I was going to do this. And I was so surprised that actually I was speaking with Lene. I was speaking with a co-founder. I was not speaking to a receptionist who was just like, egg freezing, you can freeze some eggs, it's some liquid nitrogen. It was so different, and it already made me feel so much more valued. Because it just means that somebody goes in and says, we're here to actually answer your questions, not just give you our read down. And so that was really great. I felt much, much more confident about the process then. Also, Lene gave me a lot of information after I told her about my Excel sheet with all of the information in there, because for me, I had amassed all of this data, but I didn't really know how to compare it. And so there was, the explanation of what it actually means, that maybe people freeze down their eggs, but they don't necessarily come to retrieve them in the end. Maybe they get pregnant by themselves naturally in the end, or maybe they do IVF then with a future partner or something. But that doesn't mean that the eggs are not good quality. It just means that there is a different circumstance around it. And then what personally for me was a really, really important bit was the assessment of the quality of the eggs. And so then again, it was great to talk to Lene herself in the moment, because the development of this AI assessment of the eggs and how actually the cells are looking, and how then they will be, their data will be translated to later whether or not they form in the end an embryo. Like, all of this is data that I just appreciate so much. Again, as a scientist, this is what this is all about. If I'm trying to do the best thing for my body, it is not a cheap thing either, so I want to do it the most efficient way and most effective way possible. Then knowing if I have good eggs or no, that's so important. And I have not seen that in any other clinic. No other clinic, as far as I know, in London is offering this assessment on the quality. And so I think it's also, that then gave me much more of a feeling that I could, for myself, make a good call on whether or not I need to do another round of egg freezing or no. Because if I know that maybe I have 20 eggs, but they're all terrible quality, then I know I probably should do another round. But if I have less eggs, but they're really good quality, then again, that puts me in a different situation, and I can make more informed decisions. So that was really important to me. And then I compared a little bit more after, went a little bit back and forth. Should I not? But in the end, I made the decision that I do want to do the egg freezing, and with Ovum, and I then also spoke to the other co-founder, Felicia, and that was also really lovely, and it made me feel, again, like people just really cared. Like this was really about the patient and about each patient's particular circumstances, because we're all coming into this situation of wanting to freeze your eggs, not because you're having a great time and everything is amazing in your life and you're just thinking, oh my God, have a bit too much money, I should really take some hormones and freeze parts of my body down. We're all coming into this from a place of like quite high emotion, and I think from everybody that I've spoken with at Ovum, from the nurses to, again, the co-founders, everybody just felt like, to me, like they cared. So if I come in and I'm crying, that's fine. If I'm coming in and I'm really worried about, a rash, that's absolutely fine. And all of this was already, like I can just say that my entire experience really went along with this. Like there was no difference in behavior throughout. And that's really been one of the very, very positive things for me as well, that in comparison to the other clinics, seems to be very different. So I have not done any egg freezing with the other clinics, so I cannot say anything about how that really is in the process, but I looked at the reviews. I can tell you, the negative reviews from many, many of the other clinics are particularly about this, that they just feel like they're not being seen as a person, that it's not personalized, that they're just being sent through what I've heard from many people is like cows, like on the way to slaughter, just like inject some hormones here, get in the operation room, cut some stuff out, okay, recover, goodbye. We're all humans and we're all with our unique stories, and so we need more care. We need psychological care. We need people around us who understand that this is, possibly a really hard situation that you're in. And so I can really confidently say that I was very, very happy with that. And for me, personally, would always do it again. If I need more eggs, I'll go to Ovum. I asked whether or not we could already tell approximately, based on the information that we can gather about my body, so that's my AMH and the number of follicles that we see via scan, how many rounds of egg freezing I would need. And the suggestion was that it was 2 rounds. And so I made the decision to go for 2 rounds. I was very excited that I got a little discount because I paid for 2 rounds from the beginning, so that was great. Love a little discount always. And it then also was something that made it more possible for me to even do this procedure as well. So it was, it was very, very appreciated, which again is not necessarily something that other clinics do. And so I started with the first round, and I knew that I needed to kind of expect emotional times, positive, negative, confusing. I was kind of imagining it like as if I'm on my period for 2 weeks. That was my imagination. And I think what happened since the beginning was that the injections that I then had to do on myself, they were really odd to do. Like in the beginning, just getting over this mental block to stick a needle in yourself, that was very odd for me. But once I got through that, I felt so empowered. I felt, honestly, the first week on the hormones, I felt so good. I had no anxiety, no panic, felt amazing every day, all day, felt really strong. And I remember that I used to then go still to the gym, and then at some point we kept looking at my follicles, and they were getting bigger, and at some point the nurses were really like, Kate, really just like stop. I know you have a lot of energy and you feel great, but you need to take care, because this is now a new situation for your body, and you don't want any torsion of your ovaries. And I was like, okay, that sounds bad. Let's not do torsion of the ovaries. So I stopped a little bit with the workout. But see, again, this I also felt like I had like somebody constantly there who knew what my situation was, that I was feeling really good, and that I was working out and that I was doing all these things, so that they could really react to how my body, again, just my body, just Kate's body, not somebody else's body, was behaving in that particular time during the process. So it was really nice for me to again have somebody to always talk to. You also see them every 2 days anyways, so you get really close with the people there. And I also enjoyed that there was an app. In general, just having an app, having something on your phone where you see your own progress, where you see, oh, this is how my blood tests, how the results of my blood tests look like. Oh, this is how this hormone increases or decreases. And then also in the end, how many eggs did I have? How many follicles did I have before? You have all of this information there. And I love a graph. Love a graph. So there was a little graph that was great, and I really wanted to also keep this as a memory for the process as well. And I still have the app, and I still sometimes look at it and I show, you know, my friends and people that are interested, and I say, look, this was my process, and here I am with my eggs at the end, you know. And it was great for me. It really felt like it was something that was not just on paper in somebody's office, but it's almost like I had direct view into my process. Then after about a week into the first process, I was starting to feel really heavy. Obviously the follicles, they get bigger and bigger, and I was really feeling really weirdly for the first time, like maybe it's this, like when you're becoming pregnant at some point, because that part of your body just kind of expands. But I had, again, really good support at all of the time, because whenever I felt like a little bit uncomfortable, just because of, I guess, organs moving differently or being laying in a different way, you know, I immediately had people that I could directly talk to. And that means I had a WhatsApp number, and I can tell you, I was always on this WhatsApp going, I have a rash. Is this normal? Here's a picture. Oh, today, you know, my left side hurts a little bit. And always somebody was there to listen and to talk to me. And if there's, you know, ever a moment where something else was needed, they were there. And so towards the end of the first process, I then was getting a little nervous, because this was the first time there's the trigger shot. So there's a shot that you have to give to yourself about 36 hours, I think, before you actually take out the eggs at the end when you have the surgery. And that meant I needed to give that to myself in the middle of the night, 11:30 p.m. needed to give myself this shot. So you know, also that worked, and I worked through this moment again with the support of the people from Ovom. And my first egg retrieval was really interesting. It's like nothing I have done before. It's a little bit like when you're sitting on the gynecologist chair and then you're just taking a nap. And then you get a snack later. But it wasn't painful necessarily. It was more something that feels weird, because you obviously you do feel like something is up inside of you. So the procedure of taking out the eggs obviously is a surgery, but it's quite minimal. It's not invasive in that way that you get cut open or something like this, but you do need to recover from it. So I did feel a bit weird over a few days, but I also realized that was because of the antibiotic that I was taking. So I think my gut just wasn't on board with that, because then for the second round, we then exchanged the antibiotic, which was again in context with my own personal experience during the process, and I got different antibiotic, and I was fine after like 24 hours, and I had no problem whatsoever. So I really think it was the antibiotic. So that to me was just, again, like one of those moments where like, oh, you go through the process once, and then we learn from what has happened. So we learn how much of each of the hormones you're taking, and then you get a reassessment of whether or not we should stay with that amount or change, maybe go higher or go lower in the dosage. And for the second round, we went up with the dosage. Now, I did realize that also meant there were more follicles growing faster, but that also meant more eggs in the end. So I was really, really impressed, and actually the number of eggs that I could achieve, my body could achieve to grow during that time, in comparison between the first round and the second round. In the first round, I believe I had 20 follicles that had eggs in it, but not all of those eggs were in a state of maturity that they were good to be frozen down. In the end, we collected 14, which was really, really good and was much higher than I think many people expected, including my team. But more is always better, so I was like, great, amazing. But I was really hoping for 20 as a total through after both of the rounds. So I was already at 14, so that was good. I also then, of course, had a look at the AI assessment of these eggs, and it was really interesting because some of them were super good and some of them were not so good and some of them were medium. But the vast majority of them were very good quality, so that made me, again, feel quite safe and in control, that I know, like, okay, I have 14, and then maybe 10 of them are, like, super good. So that makes me feel good about the process. And then for the second round, I actually had 25 follicles, and I got 20 mature eggs. So I have so many eggs now, and it's really great. I feel like, because this means now I have over 30 eggs, which is much more than we anticipated, but this is also because the second round, we know how my body reacted with the treatment and the particular dosages, and then doing the second round, you can then tweak that and really improve and optimize it. And so that to me again just shows that you're not just a number, you're actually a patient, and you get studied and your chart gets studied, so everybody gets the best result out of it. And I really appreciated that. In the meantime, I really wanted to stay in contact with people at Ovum, which I did. And again, I'm here making this video not because I think I need somebody to do this just because it's Ovum, but because I actually really believe that I now, after freezing down my eggs, feel like all of the fears that I've had before, where I said, oh, I'm 35, now I'm 36, after the breakup, what do? I don't have control of myself. All of these fears now, I understand them still, but I don't have them anymore. I feel like I have now more control. I know that it doesn't mean exactly the same thing as saying, I have 20 eggs, I'm going to have 20 children. I know that's not what it means, but my chance to have children later on in life is still there now, either with my own or maybe even through a surrogate somewhere else, potentially, who knows. But all of this is now a choice that I can make. And that was really important for me. And I think that's something that was enabled through this whole process. And I'm really glad I did it with Ovum and I did it this way. All of this I'm really, really positive about. And I really feel very strongly that we should tell women earlier about this process, just that they have the choice. Not that everybody has to do it or, they have to do it early or whenever, just that they know. Because knowledge is always power.